cushions and the table and pick up your body onto the board. So you're helping him. You got to stabilize the board too. Now, at this point, let him do a lot of the work. Teach him where to put his arm.
Alright, reach your over here on this armrest.
Put your hands
Okay.
out. Don't put your fingers under the door.
Yeah, don't put your finger up. Right, exactly. And you're just going to sort of guide him. Your feet aren't touching. And just guide him over. Okay? So now, come on back over. Okay? So, now try it yourself using that board. Yep. So, come on back over. So he's so strong that he really didn't even need the board. But not everybody has his strength. So this time you can do it actually be onto him and just slide. Okay. And then go forward a little bit so your butt's on the just slide on it. Okay, so that's another way you can do it. He had the strength to put his whole body weight on it. Alright, good. So you guys see how that works? So that's a whole different example. Now we're going to do somebody who has an amputation. So this person has fairly good use of their arms. 4 out of 5 strength in the arms. They have 5 out of 5 strength with the left leg, but his right leg has been taken above the knee. So he's a right above knee amputation. Okay? So now help him do a transfer.
Same with the
Slide board transfer. Okay, so you can use your left leg fully and you can use your arms.
Right?
Both arms forward.
Yep.
And then use this arm. Use arms. This is so, I don't know. What? Yeah.
Why can't you just use his left leg and stand up?
Yeah.
Sorry.
Stole my thunder. It's okay.
That would be.
It's okay. So what I'm getting at is who would be most beneficial, or who would it benefit the most for using a slide board? Somebody who has a hemiplegia, someone who is an amputation, or somebody who is a paraplegic. Well, a paraplegic over time will develop the upper body strength to probably be able to do the transfer to the wheelchair without a board. Somebody with a amputation, stand up and turn and don't put any weight on your left leg. Keep your left leg up. Right. So he stands up, he hops, and he turns and he sits. So they don't even need a slide board. With a hemiplegia, it doesn't work that way. So come back. So with hemiplegia, now you have 0 out of 5 strength of your right leg. Let's say 1. Let's say 1. So that means with his right leg, he has 1 out of 5. So now if he tries to stand and turn, try it. You got 1 out of 5 on your right leg.
But you can't use his right
Exactly.
arm. You can't use his right arm.
Right, you can't use your right arm either. Yeah, so now just try and stand with one. But now use the muscles to lift that right leg out of the way. He doesn't have enough hip flexor strength to lift it to get it out of the way. So that's why people need the board to transfer safely. Otherwise, they'll fall. They'll stand up, their knee will buckle, they'll fall. Their perception of midline is shifted. So the hemiplegic patient population is the one who benefits most from this.
With the midline, does that happen with all hemiplegics?
No.
Okay.
Yes.
First of all, put your feet just under the Alright, so now would you want to move anybody with their feet not touching the ground? Okay, so always remember, adjust the table so you have their feet securely on the ground. I mean, if you're going to transfer them, you could say, if you're working on stand, you can say scoot forward. But it's better to start off with their feet on the ground. And 2, on the transfer board, can you put that under your booty?
What about patients that can't put any weight on their, that aren't supposed to, doctor's orders not to put any weight on their legs, their feet, whatever?
Well, you can still use
bilateral non-weight bearing.
Yeah.
upper extremity though.
I'm just saying,
Well, then
if
you're
you put,
gonna be
if you put it
sliding,
to
aren't
their
you?
feet,
They do this. Watch.
If they slide.
But she's talking about
Sit
what
long,
you're saying
sit
to
long,
start
sit
with your
long,
feet
sit.
on the ground.
Oh,
If
yeah,
they're not
no, no.
No, they do this. Turn your body around.
You come backwards. and
They do
then
the
here.
reverse.
Okay.
Oh, I thought you meant, okay, I see what you
You
mean.
see what I mean?
yeah, we're good. Clear.
Okay, sorry. I
No,
thought
no,
you
no,
meant-
we're good.
Okay,
Yeah,
can you put the board under your butt?
I was gonna say, I took a picture and I sent it to everyone this weekend because I had a left CBA and on their board, his transfer was a squat pivot.
You could do a squat pivot too. Come on, show it. So here's another thing you could do. Now, you could do a squat pivot. Everybody watch this squat pivot. You can take the board out. Yeah, it's about there.
So with the left arm, we're just gonna on 3 minutes stand up, pivot.
So, come on back. So basically, the reason why Gabe did that, he didn't have enough strength on his right leg to come all the way up and stand and then turn. So he went from a seated position to a little mini stand, half stand, or half squat, however you want to call it, and getting over to the chair. You guys follow why he did that? Now, Susie's a therapist, and she says, that's good, Gabe. I'll do that for the first couple of weeks, but I don't want to keep doing that. I want my husband to get up and transfer to put weight on that right leg. So here's the therapy intervention. Come on over. Put, Kelly, if you could give her your chair. And have her sit right in front of her.
No.
Yeah, she was fine.
They're rolling so hard here.
So this is what I like to do with my patients. So she's going to come right in front of him. You're going to scoot forward. She's going to put your knees between his legs. So in other words, your left knee is over here and your right knee is there. So if you guys can see how her knee is positioned, so his knee, his right hemiplegic side, which is his weak side, supported. So now she's going to do things. She's going to say, okay, lean forward. So he leans forward. So we all know that if he leans forward and goes this way and go up on his left leg, go ahead, he stands up and his left leg is fine. But she says, I want to strengthen his right leg. So when he comes down, she's going to put her hand here and other one above his knee. So now what she's doing is when he goes to stand up, she's shifting his weight over to his right leg. Now stand and push your hand into his. So now try to stand up tall. Buckle your knee. No, you stay right there. No, you stay right there. So he's buckling his knee, but she's got it supported. She's pushing with her hand to straighten his leg out. So now his side that he had a stroke on is weak. So the best way to get a limb strong is to put weight to it. So now she could take her hand and drop it to his hip and start pushing him over and saying, let's stand on your right leg 10 seconds and then come back.
At that point, should I maybe grab this thigh? I feel like knee's still kind of like not very good holder.
You could grab his anterior thigh, but push it back. So push it towards me. Because now, Kyle, pretend your knee's going to buckle. So when he buckles, you want to get him to stand up straight. Okay. There you go. So you push into his, and you can get him to stand up straight. Okay? Good. That's very important to increase weight bearing, locking his hemiplegic side in practice.
Would you want to pull the hemiplegic side back, right? Push the other foot forward. Want that force?
If you want to work on sit to stand, so what she's doing here basically is Kyle gets to the edge of the bed. So right now, when he goes to stand, he puts both legs underneath him. Go ahead. Pretend you're normal now. Okay. And lean forward. He stood up. So now come back down. Put your left leg underneath you and your right leg out towards Susie. Now lean forward to stand. 80% of his weight was on his left leg. Come on down. So now put your right leg back, left leg slightly forward. So now when he stands, so now he's forced to put weight on his right leg. So that's what Josh is saying. And yes, the answer is that you could do that as well. Yep. Anything else?
Yeah, I just wanted to go back to the slide board really quick. If you could just put it on there. The general guideline for the slide board is this hand moves distal, and if they can use this hand, you want it close to the side of their body. If they can use it, if they can't use it, you can always, and that's how you usually use the slide board for your SCIs or TBIs. So just make sure the hand that's moving towards is always out further and the other hand is closer.
Perfect. All right, guys, we have 3 boards. Practice that on